We oppose this language because we feel this is a permanent restriction for a temporary problem. Current administrative rules on assisted living facilities, as previously mentioned, address the requirements for resident rights, visitation, disease prevention, and a grievance process. Throughout this pandemic, all healthcare providers have had to adjust to restrictions, precautions, and staffing challenges. Every provider will tell you how hard it is to lock down the facility for the safety of their residents. Staff struggled with trying to meet the social and emotional needs of each resident while witnessing firsthand the devastating impact of COVID in their building. Long-term care facilities are still challenged with the fear of COVID infections, the availability of adequate PPE and funding and testing supplies, staffing, and the vaccine's unknown impact of transmissibility. These are critical factors to consider in any visitation policy updates and/or mandates, and we could not agree more that it's time to bring residents and families back together as soon as possible. I think COVID has revealed several areas for improvement, and as a healthcare industry, as mentioned from one of the previous testimony, we do have to find a way to better manage safety protocols amid the stress on clinicians and long-term care providers who have been operating at peak operational capacity for nearly 12 months now. We would like to thank the sponsor for bringing this bill forward to create an open dialogue on how we can improve communication between facilities and families in the event of a disaster, but we feel this bill is unnecessary due to the already current regulations that are in place. And in the event of another mandatory lockdown, we do not feel it's necessary to legislate how private industry, so assisted living facilities who are not under federal guidance and generally are funded by private pay, manage their communications to residents and families. So assisted living facilities really vary by size, ownership, levels of acuity, staffing, services, governance models, and administrator requirements. So one size truly does not fit all when it comes to assisted living.